Hello and a very warm welcome to this session on world population and gender equality in the post-COVID era. Now, as we all know, the impact of the pandemic has been particularly acute for women, both in terms of their lives and their livelihoods. And that is particularly the case for those who are living in middle and lower income countries. We've seen impacts in terms of increased violence, in terms of reduced access to family planning. At the same time, we know that family planning is one of the best ways to empower women and to support poverty reduction more generally. My name is Ayatollah Rahman, and I'm the founder and CEO of Business Fights Poverty, a business-led collaboration network focused on social impact. And I'm joined by an excellent panel today to explore these issues and understand what actions we need to take. So with me today, I'm joined by Klaus Runge, who's the head of Market Access, Public Affairs and Sustainability at Bayer Pharma. Mariosa Coutillo, who is the Chief of Strategic Partnerships at the United Nations Population Fund, and Samira Al-Tuwaidri, who is the Lead Health Specialist at the World Bank. So let's kick off our conversation. Before we do, though, please do introduce yourself in the chat function. Tell us where you're joining from. And as we go through the session, please post your questions and we'll put those to our panel. So let's jump in. I'm going to ask each of our panelists to help us set the scene. Tell us a bit about what you think we need to know about the situation facing women and girls. In doing so, also maybe introduce yourself a bit as well. So let me start with Maria Rosa. The floor is yours.
Thank you very much, and thank you for having me here today. As I said, I'm Zahid. I'm Maria Rosa Coutillo. I'm the chief of the Strategic Partnerships branch at the United Nations Population Fund. So the United Nations Population Fund is the sexual and reproductive health agency of the United Nations. We lead on what we call our 3 transformative results: 0 unmet need of family planning, 0 preventable maternal deaths, 0 harmful practices, and gender-based violence. So a full agenda for women and girls, but not only. Maybe the first and key message I would like to bring here today, and also thinking about my background, I'm an international jurist. My field of research in years has been business and human rights and inclusive multilateralism. So the initial probably message for setting the scene here is the importance of ecosystems of partners. So one of the main lessons that we learned, and we are learning still in the COVID-19 era, is the importance of the ecosystems of partners. And we're talking about this here today when we talk about access to family planning. But when we talk, first of all, of what we call the right to bodily autonomy. So the first figure I'd like to put on the table today is more than half of women in the world can't choose. They can't choose if, when, with whom to have a child. They can't have access to the right to bodily autonomy. So this is something that we really, really need to take into account. And this is where I come from when I talk about partnerships. We need to talk about collaborations. We need to talk about coming together to face this and address this, because the North Star of the Sustainable Development Goals is still there. We don't have to miss that North Star. And we don't have to miss the progress that we achieved before the pandemic. And that progress is at stake now. So this is my first message setting the scene. Thank you.
So very powerful statistic there. We'll come back to some of those points around partnerships, I'm sure, during the conversation. Samira, what's your perspective on this?
Sure. Thank you for having me. It's always a pleasure to be on these on dialogue platforms. And I think the pandemic exposed some of the things that we've already been struggling with, and at the same time sort of magnified what we have been again struggling with. So we can already see that the pandemic and its economic fallouts are having a very noticeable regressive effect on gender equality. If you take, for example, the economy, women jobs are 1.8 times, almost 2, more vulnerable to this crisis than men's jobs. Women make up around 39% of the global employment, but account for 54% of overall job losses because of the lockdowns and what have you. And one of the reasons for this greater effect on women is that the virus is significantly increasing the burden of unpaid care, which is disproportionately carried by women. This, among other factors, means that women's employment is dropping faster than average, even accounting for the fact that women and men work in different sectors. So one of the really very clear messages is, if we are going to do any mitigation measures to actually bring the economy back to where it was, or at least close to what it was. And also, one of the things that we are calling on nations to do is have this pandemic preparedness. Within it, there needs to be a greater emphasis on what do we do with the fallout of the economy when it comes to women jobs who are already very fragile, and they sort of fall out of the bandwagon easier than men jobs do. I'll leave it there.
Thank you so much. Klaus, interested in your perspective as well.
Yeah, thank you, Zahid, and I'm very pleased to be here in the panel with Samira and Maria Rosa. I'm in charge of global market access, public affairs, and sustainability within Bayer Pharma. And in this role, my team and I are responsible for providing access to contraceptive options and methods to women around the globe. Pre-pandemic, it dates back to 2019. We've been at the Nairobi conference, the ICPD 25, to see what progress had been made against the SDGs, also in terms of the population development, etc. And at the time, we actually committed to providing 100 million women in low and middle income countries with access to contraceptive options and methods around the globe in low and middle income countries. By the time, the gap was roughly 230 million women in these countries affected that did not have any access to those offerings. And the pandemic has even worsened the gap and expanded the gap. So there's a double-digit million more women who lack access to contraceptive choices. But still, we have learned in the pandemic what is needed to really up our commitments and to really make sure that we address the needs that women have. And as was mentioned in the ingoing comments, action is truly needed. And so we stick to the commitment more than ever. So we're committed to that goal of 100 million women by 2030. We know it only works in partnerships, as Maria Rosa told us before. And we also, in the light of other players backing up a bit and pulling funding out of the system, we want to help closing that immediate gap by offering some more donations and product in kind to the UN in order to help the gap being smaller over time. So I think we all need to learn the lessons from the pandemic. We need bold action at speed. We need to work together across borders, and we need systems-based approaches. And that would be my ingoing comments.
Thank you, Klaus. So one very clear message already from the three of you is that there clearly is a shared understanding of what the issues are. And as a number of you mentioned, the pandemic really has highlighted and exacerbated some of these impacts. The question, I suppose, then is the global community prepared and ready to take on this challenge? Perhaps, Samira, you could kick us off on that. You know, are we able and ready to deal with these issues?
Thanks, Zahid, once again. I missed the opportunity of introducing myself and what I do in the previous question. So I'm the Global Lead on Population and Development at the World Bank, Healthy Nutrition and Population. And as such, my portfolio really deals with a lot of the population dynamics, including the dividend and what have you. And I say this because I think as a global community, we really have missed out on the gender dividend. more than anything else. We do talk about gender equality, we do talk about reproductive health and rights and what have you, but we stop at converting that conversation to become a mean to an end rather than an end in itself. So lowering maternal mortality is a health issue, but it's also an agency issue more than anything else. So I think the global community was hit very hard by the pandemic. No one would have ever believed that it's going to have such an impact and for such a long time. And I'd like to remind ourselves also that the pandemic before that was the Ebola crisis, and the Ebola crisis was contained fairly quickly. I mean, it took lives and it disrupted economies, but it was much more contained. We haven't seen anything like the COVID-19. So that said, I think that was the very striking example of what are our priorities as governments, as an international community, as even community health workers at the subnational and at the village level, is to fight the fire more than anything else. I mean, the infrastructure, the health system behind it is weak to remain positive. I don't want to use stronger words than weak. And we've seen it in advanced economies, and we've seen it in developing countries. I mean, this virus had equity written all over it in the time and the way it attacked. So are we ready? I would like to think that we probably have learned a very hard lesson on the pandemic preparedness and how this actually needs to be part and parcel of all the national health plans when it comes to health systems strengthening. And we do use this term, right and left. The World Bank works heavily in health system strengthening. It's our flagship, but at the same time, when you actually apply that magnifying lens, it comes down to really the tertiary care or the secondary care, with little or no emphasis on either the primary healthcare chain or the social determinants of health. Because within this pandemic, we saw what we've learned in schools. Poverty has an impact, gender has an impact, sociocultural values and indicators have an impact, yet we are still focused on building more and more healthcare facilities. So we need to be more focused on the health system as a whole and what attributes gets into it, as much as we actually focus on the response. So I would like to think that we've learned a lesson, and probably going forward, we would be much more prepared. But I think bouncing back to where we were prior to December 2019 is not going to be impossible. Difficult, but it's not going to be impossible. Thank you.
Thanks, Samira. I think implicit in a lot of what you're saying there is the opportunity for us to actually come back to a better place than where we started before the pandemic, if we can deal with some of these more systemic issues. I'd love to hear perspectives from those of you in our audience as well, so please post those in the chat and we'll reflect on those as well. Maria Rosa, I mean, your organisation as well has been at the front line of this. Just share your perspective on the global community and whether we're ready and how we best do it.
As you were asking this question, and I was also listening to Samira, probably I would ask a question that says, are we ready to make the right choices? And I go back to the last point that Samira made. Is actually this pandemic really teaching us lessons that we are able to capitalize on? I think yes and no. I think probably we are not ready to give you a very strong answer to this question, and because a lot is still going on, and because there are many, I call them temptations here. And one of the temptation is to look inward and not having a vision towards the future. I think one of the main lessons that this pandemic is teaching us is that we need to have an integrated view. It's not only about economy, it's not only about empowerment, it's also about social justice. It's also about inclusivity and equality. We don't have to forget that. There were many variables that came together during the pandemic, and I think all of them can inspire the international community in having an integrated, sustainable view. When we talk about, for example, of course, you know, for us, for UNFPA, one of the flagship messages is, of course, gender equality, but it's also shedding a very strong and constant light, for example, on gender-based violence. This has been striking strongly a pandemic in the pandemic. And when the lights of the media and when the lights of the global attention are over, this is still there. So we have a responsibility to keep that light on. And the international community has to come together in this. There must be a strong, strong stance for this. So all these variables, I call them variables, they come together into this integrated approach. And you know, one of the temptations, for example, is to stop or reduce financing, is to stop or reduce funding for the Sustainable Development Goals. Well, the consequence is that the most vulnerable remain the most vulnerable, and they are even more excluded by development and human rights processes. So we're not achieving one of the key, I would say, goals of the Sustainable Development Goals, which is leaving no one behind. And family planning, access to family planning, and I go back to what Klaus was mentioning before, when he was mentioning the Nairobi summit, access to family planning is one of the keys to unlock the potential of this integrated approach. When Klaus was mentioning the Nairobi summit, well, actually, that was an historical summit because it brought together public, private stakeholders with commitments. But you know, commitments have to be kept. You don't go to an international conference, you don't go to, let's say, a meeting that puts you in the eye of the international community only to make a commitment that remains a word. You need to follow up with that. So I think the first answer to your question is, let's resist this temptation not to keep commitments and engagements.
Thank you. And I would like to come back to that in the conversation. And it's great to see we've got people who are joining from Brazil, India, Colombia, Philippines, Algeria, Ecuador, South Korea, Lebanon, Finland, Ukraine, and the USA so far. So please do, if I've missed your country, add it into the chat so we know where you're joining from. Klaus, in your opening remarks, you mentioned partnership, and I know your commitments are broad ranging. From the point of view of an international company, how are you seeing the global community responding or perhaps not responding in the way they should?
I mean, doubtlessly, I mean, we've all experienced it in private life, but the pandemic has really put societies and also healthcare systems under extreme stress. So, and under this experience of extreme stress, we've seen some, let's say, coping mechanisms that are really in sharp contrast to what we want to achieve in terms of gender equality. So if you think about the number of women in the healthcare sector serving at the front line, it's the vast majority of healthcare workers. And at the same time, we see coping mechanisms such as child early and forced marriages in some countries that really put at risk the progress that we've made over the past decades in some geographies. Just to shed a light on sexual and reproductive health services, they are being seen as non-essential in some geographies and countries. So policymakers don't see them as a standard tool in servicing their respective populations, and that is an issue, especially in times of pandemic. Clinics, hospitals, facilities have been asked to really limit their services to purely essential services, and if you're by definition not on that positive list of essential services, you get a gap in the provision of these important services for women. So I think there we really need to stand strong and continue to repeatedly ask policymakers around the globe to really anchor these kinds of services as a main healthcare instrument in their respective countries, because it is so beneficial to women. If you think about the opportunities they can have in terms of education, when they can plan for a family, etc., etc. Also, the local economies can strive further. So we really need to make sure that they are being seen as essential services.
Thank you, Klaus. I was just building on that point. In a sense, what I'm reading from what number you were saying is COVID-19. Okay, it's highlighted a lot of these issues, but is it in some sense distracting us, pushing us off the strategic path, making short-term decisions, perhaps, not perhaps putting priorities in the right places? Perhaps, Samira, maybe from your perspective, given your role at the World Bank, is that a fair characterization that we're perhaps being distracted by COVID-19 to some extent as well?
Of course we were. Again, we were completely unprepared. I mean, it wasn't the first pandemic that we've had to struggle with, but at the same time, excuse me, the magnitude and the extent to which we have been witnessing, especially in countries that are again ill-prepared, is magnificent. I mean, gains in the past decades remain actually very amenable to falling back and out, and a profound shock to our societies and our economies. And when resources are strained and institutional capacities are limited, we find it, across the board that women and girls have been impacted much more than anyone else. And let's also not forget that this pandemic also had a lot of political dimensions. In some parts of the world, it toppled governments simply because the repercussions of the pandemic were not only just people dying, as hard as this is, but the lockdowns, the impact on the economies, the loss of jobs, the isolation, the impact of mental health. All of these things really sort of all conspire to actually give us worse human capital outcomes rather than just health. So we're talking about all the aspects of the human capital accumulation, and all of the gains for the past, I don't know, a decade or two had actually been thrown out to the winds. And again, this was not just the developing and struggling countries and economies. We've seen it in the United States here. We've seen it in the European Union as countries. So we were distracted because we were caught off guard. We were not really prepared to the magnitude of the problem. And I dare say in some parts of the world, we were not even prepared for the principle of a pandemic actually hitting, because the last big one we've seen was a century ago, and everything that we know now is quite different. I also would like to throw in another dimension of the whole thing, which is something that was mentioned by Klaus and Maria Rosa already, which is this issue of deepening the marginalization and the violence against those vulnerable. We've seen a huge spike, 6 to 7 times, in domestic violence, simply because these people are locked down in the same space where there is really no ventilation window, no escape, and so the abuse became much more magnified. Schools were closed where girls and boys can have also that window of opportunity to sometimes eat, which is a basic human right, but also to to have that social support structure. So I think distracted is an understatement. I think we were completely swept away by trying to fight the pandemic and finding the vaccine or noble causes or probably the right path to go on. But at the same time, I think we need to really focus much more on the essential health services that saw the first jolt when we repurposed everything to actually just do the contact tracing, the testing, and the isolation, and then repeat that cycle again.
Yeah,
thank you.
Thank you, Samira. And I'd love to get a perspective from those of you who are watching as well. I see we have 2,500 views now, 40 countries. So it's great to see so many of you joining us. but please do share your perspectives as well. I guess listening to you, there's clearly our priorities that one has to identify, especially if what you're saying is we're seeing the worsening of the situation for particular vulnerable groups. From your perspective, Maria Rosa, if you were advising governments who are having to make tough decisions in the context of the politics and the economics of the pandemic, where would you recommend that they focus their attention and prioritize if they want to drive gender equality?
Well, I think that as I was mentioning before, what we are actually advising, or we are actually bringing as an added value on the table now, is really the integrated approach. So the fact of thinking about policies, thinking about programs that have a very strong footprint in the communities. And one of the things we always say is think about the 10-year-old girl. So invest in girls and adolescents, and make sure that there are all the different social protection measures that make sure that they are empowered, they thrive, they have access, yes, to sexual and reproductive health and rights, for sure, but this is part of a broader vision. So this was actually one of the key points of our, let's say, threefold emergency plan during the pandemic, where of course we worked very strongly on our supply chains to make sure that family planning services were actually kept as much as possible. We worked to make sure that SRHRs, so sexual and reproductive health and rights, were part of country plans wherever we operate in 150 countries, and that there was also a very clear mention and action by governments against gender-based violence. So this is part of this holistic approach. I think we were rather successful in 2020, by the end of 2020, of having at least 87% of the country plans in the countries where we work, so in 150 countries, having those priorities as part of their national plans. Of course, I go back again to what we were saying at the beginning, committing and writing something on a paper needs to be followed up, like really concretely, with actions. And so the next step now of our engagement as a priority is really to work with these governments to build these ecosystems of partners where what has been put on paper can actually be implemented. And one of the most interesting things that we are seeing is that this pandemic has actually offered a way to think differently, particularly to community movements of women, particularly to community groups of women. And we're working, for example, also with national governments to empower women, small and medium enterprises to somehow thrive, not only under the rights point of view, but also under the economic point of view. And I think that's an important starting point to rethink differently after, and also, unfortunately, still during the pandemic. So looking at the community, at the footprint in the community is really key at the moment.
Thank you. I'd like to turn our attention to the role of business. So there'll be other companies, I'm sure, watching now. Klaus, from your perspective, give us a sense of practically what Bayer has been doing to address some of the challenges we've been talking about so far.
Well, I mean, there is a broader response to the pandemic that we've brought on route as a company, and I have to say we've really experienced all employees stepping up to our vision, which is health for all, hunger for none. So I think the collective effort has been really unprecedented, like in many other organizations, including the ones here on the call and the ones starting into this event. So although we're not a vaccine manufacturer, we have started equipping some production sites with the respective technology to be able to produce COVID-19 vaccines, which is not something that we've done in the past. We have provided donations of medical products to the communities that we're operating in through our global network of affiliates. We have been very much involved in multinational, multi-corporation, multi-institutional activities such as the Therapeutic Accelerator. We've opened up our product libraries to see whether we can screen for products that have an impact on a COVID-19 infection or could even prevent it. So there's been a real broad bouquet of activities that we have triggered across the globe, like many other of our peers, in all fairness. In the area of sexual and reproductive health, the number one priority we always had, and not only in this field, is to hold up supply chains. That was one of the biggest issues we have faced, and emerging trade barriers in times of crisis. So that was something that we have really thoroughly addressed during the pandemic. And we can pride ourselves in saying we've been able to deliver the products that we offer to patients and users worldwide. So we didn't have any stock outs or so, and we've been able to also provide the contraceptive options to our partners such as UNFPA, USAID, and others. And we could even increase the user base by 2 million women in a pandemic year. So it really is, I would say, a strong commitment that we've seen by many of our employees, and the belief that the partnerships we're in over the long run are really necessary to give us the leverage to reach more women. So with all the, let's say, threats and downsides that have come with the pandemic, there is a rising belief that the international cooperation and strong partnerships can deliver solutions at speed. So that would be my impression of how we've been able to hold up services for women in low and middle income countries.
Thank you, Klaus. And I'd like to come back to some of that in the Q&A. I see some good questions coming in around the role of business. So please do just keep those questions coming, and we will turn to those shortly. One of the other issues I'd like to touch on is around youth. You mentioned it, Maria Rosa, briefly as well in your remarks. But one thing I found starting as a fact, which I wasn't aware of before, was in this 15 to 19 year age band, actually complications during pregnancy and childbirth are a leading cause of death. So taking that angle on young girls, what can we do, particularly now, to address the issues that group are facing? Perhaps actually I might ask Samira to lead off us on that question.
Sure. So dealing with young people had always been a minefield because their sources of information, as you know, is not their family, their parents, or it's actually their peers, and especially when it comes to sexuality education, to risky behavior, there is a lot of peer pressure, and there is a lot of wanting to belong to the gang and imitate and all of these things. And I also think that during the pandemic, the fact that these schools were closed really had a huge impact on this age group, not just because of the lack of opportunities for learning and the digital divide and all of these things, but it also sort of deprived them from that sense of unity, that sense of community. So and as I said at the beginning, it's always been sort of less easier to include this age group into our programming for a variety of reasons. And one of the things that we've been trying to do within our work at the World Bank is try and hardwire this age group into all of our programming, but specifically on messaging and on communications. So you cannot have the same message that goes out to the community, addressing, you know, all ages and both genders. But this is an oversimplification, because then we also need to look at this age group not just from their general needs, but also from their specific needs. There is the disability needs, for example. There is the living with you know, chronic diseases and chronic infections. There's the HIV/AIDS population as well. Luckily, it's getting less and less in the world around us, but there are still some of these cohorts. So we need to hardwire all of our efforts and try and focus on this age group as an independent and difficult to tackle age group through the communications and the programming. The second thing, probably, and we've had a good experience within that, is to mobilize the communities to actually have somebody who's a champion, somebody who's trusted, you know, a football player, a singer, somebody that this age group actually subscribe to the messaging that comes from that individual, be it, you know, from the same community or also outside the community. And then the last thing I would like to put on the table as well, and when it comes to the adolescents, is also they themselves sometimes are hungry and striving for being part of the solution rather than part of the problem. So, you know, trying to identify some influencers, some of those people that can be leaders of their own cohort of populations, and invest in them. These are going to be the true leaders of the future. You know, your Minister of Health in 20 years or in 15 years. So I think there is always the potential of actually identifying some of these you know, really emerging leaders or rising stars within that cohort, and invest in them and try and have them your agent of change when it comes to this age group. Thank you.
Thank you. I couldn't agree more. Points well made there. I'd like to turn now to an issue that a number of you have alluded to, and that is, in the current context, we're seeing in different countries donors placing perhaps not enough emphasis on these issues. In the case of the UK government, actually massively cutting resources to this area. And just one example around access to free of charge contraceptives. It sounds like that's going to be massively impacted by cuts like that. I mean, from the point of view of Maria Rosa, the work you're doing, you know, how do you address these cuts? How do you face these cuts, and what's the future hold in the context of the changes that we've seen?
Well, you know, of course, these cuts had quite an impact, I have to say. Of course, UNFPA is the largest procurer of donated contraceptives, so it's obvious that we are suffering this impact. On the other hand, one of the things that we are saying is if this has happened, then we need to find also more sustainable ways to ring fence somehow the support to our mandate and ring fence the support to family planning. There have been commitments. These are signed commitments for the international community. So not only we need to keep those, but I go back to what I was saying before. We really need to make sure that our public donors, but also our private donors, particularly I would say public, resist this temptation. Resist the temptation to look only inward. Resist the temptation to cut on development investments. And this is something that I have to say, most of our donors are engaging in conversations with us on this. They are stepping in, they are supporting. But of course, the honest conversation we need to have with all of our donors is to make sure that we have a sustainable plan. And we try as much as possible to avoid ending up in emergency situations like this. And when I talk about emergency situations, I talk about defundings. So that's the first step we are undertaking. There's also another piece of the conversation, and I think this came up strongly also during the last Generation Equality Forum. If you go through the commitments that were announced in the Generation Equality Forum, there are several commitments from different types of partners to the sexual and reproductive rights agenda. It's important, it's key. It's also important that we have a honest conversation on the different roles and responsibilities. There's a role of the public sector to be kept in terms of ensuring sustainable sexual reproductive health, yes, overall health, overall women-centered health, quality health. We don't need to somehow dilute the attention on that centrality. And of course, and that's where we are partnering, and that's the work that I do with my team. We're partnering with many private partners. I'm not calling them non-traditional because now they have become traditional. So we partner with them. They come on board as Bayer is doing strongly and sending a strong message on the importance of partnerships. But the message has to be that it is a shared responsibility, and we cannot expect only the private sector or the philanthropic sector to step in and fill the gap. It's a shared responsibility with clear and different roles and responsibilities.
Thank you, Maria Rosa. I'd like to actually just pick up on that point around roles and responsibilities, and on that second piece around the role of business in the private sector more generally. And Klaus, I'd like to put this to you, but there is one question that's come in the chat around, I suppose, the engagement of the private sector in public policy, and what is the role of business in joint advocacy on issues like this? And let's call this broadly gender equality, but within that, maybe some of the issues we've talked about. But also, how do we encourage governments to work more closely, recognizing they would lead on these issues, but how do we get them to engage more constructively with the private sector in finding solutions to these issues?
Yeah. So first of all, on the role of the private sector and partnerships, I would say every private sector representative needs to know what he or she can actually bring to the table. So what is the offering that you can add to the overall equation? And that needs to be clear. And then secondly, I think you need to be very humble in learning how the ecosystem works and how the various partners that you interact with do business or do the projects. And you shouldn't come with a, let's say, predefined attitude on how others should operate in this space, because the partners we're working at, although we're in it for 50 years in terms of provision of contraceptives, we usually have been a supplier. Now we are actually in the transition to becoming a partner, offering more than just the products that we have in the portfolio. I think overall the move by the UK government also came as a big surprise to us. I mean, if you consider that every dollar invested into family planning services leads to a downstream positive benefit of roughly $120, it's really saddening to see that such a big supporter has pulled out to a large extent. The good news is there are others who are increasing their efforts, like France or philanthropists. We also have contributed to closing the gap as much as we could. But I think the message, which is even more important from us as a company, that even in times of a crisis, we have committed to a 250 million euro investment to expand the production capacity for the international community, which is a non-for-profit business for us, right? So we have just this year announced that we will upgrade the facilities in Turku, which is one of our strongholds in our supply chain worldwide. So we really invested heavily in it because we actually want to walk the talk and really provide 100 million women in LMICs with contraceptive methods. But the partnership one is, what can you bring to the table, and be humble and learn together with your partners?
Thank you. It's great advice. I'd like to encourage our audience to share your questions. We're going to tend to them in just a minute. I see some great ones coming in. While we wait for that, I'd like to ask each of our panelists to ask one question of your other panelists. So I'm going to start with Maria Rosa. Perhaps choose one of the other panelists and ask them one question.
Okay, so I will choose Samira because with Klaus we speak all the time. So I'll choose Samira. Samira, I think you touch on a really key point around specific actions with youth and adolescents. If you had to choose, is there one of these actions? I'm aware that it's an integrated approach, but what for you and on your based on your extensive experience, what is it that for you is really key, that has to be really a priority when we talk about empowering and making youth and adolescents at really the core and the champions for all this movement of change?
Sure, thank you, Maria Rosa. Before I dive into the question, Zahid, can I take a minute to talk also about our work in the International Finance Cooperation, which is really the private sector arm of the bank. And we've been actually doing a lot of work since the beginning of the pandemic. And we have reached a record high of $42.7 billion in financing, including short-term financing and mobilization in low-income and fragile contexts. So there is a lot to be said about the private sector engagement. It's not just about individual businesses operating in one sector. Maria Rosa, my experience as a professional, as a physician, as a gynecologist, and as a mother, is that if I were to choose one specific interaction with this age group, and this comes from my work in Sub-Saharan Africa on the SWID project, which we partner with UNFPA as well, is that you need to convert them from liabilities to assets. And that only comes through engagement and empowerment. You need to bring them to the table. Once they come to the table, you can do wonders with them. But they need to actually lose that skin of being this time bomb ticking, and ready to explode. And they will explode if you leave them to what they're doing. I think once you bring them to the table and make them a partner, you see something completely different. And that's what I do with my children. That's what I do with my clients when it comes to actually working in low and middle income countries. I hope I answered your question.
Thank you, Samira. Thank you, Samira. It's your chance to ask your question to one of your panelists, Samira.
Mine?
Yes. If you choose one of the panelists and ask them a question.
My question is to you, actually, Zahid. I once read somewhere, and it stayed with me, that if poverty would have a face, it would be a face of a young adolescent colored girl. So what are we doing for this age group when it comes to alleviating poverty?
Well, I couldn't agree more. And I think, in fact, just last week, we had a whole 3-day event focused just on youth engagement and the idea of future makers. And I think part of it actually is about, as you said, bringing people to the table who are proximate to those issues and who are affected, and so-called beneficiaries, as we sometimes refer to them in the international development community. But involving young people in the conversation and the solutions has been so important. And we've seen that very practically in our work in Kenya on COVID. We looked at why was that intervention successful. Probably number one was because it really engaged with young people as agents of change. And I think, so I just echo your point back to you, actually, to your previous question. Very good. Okay, and Klaus, your question, please.
I have another one for you, Zahid. So we promote you to become a panelist here. So I know that you've most recently have done an excellent interview with BBC, and you've been talking about the importance of investing in family planning in low and middle income countries. So where would you hope that we see most progress happening in the post-COVID-19 era?
So I think one thing for me personally, one thing the pandemic has shown is some really deep systemic issues like gender inequality, racial inequality. And I would hope that as we start to rebuild better from this, we can really deal with some of those big issues. And I've certainly seen a lot more attention being placed on that. And I think as a community, we need to think about how we really put that front and centre. And certainly for us, we're seeing a lot of interest amongst the companies we work with on those issues. I think the other piece is with COP26 coming very fast down the road, understanding the intersection between the issues we talked about today and climate justice are very important. Understanding how you empower women through a just transition and those sorts of issues, I think, are very important. So I think one silver lining, if there can be one, of the pandemic is a greater awareness of these deeper issues we must really grapple with now. So, okay, so that's enough from me. Now let's hear from our audience in the range of our time. We've got another 10 minutes. So let me just have a look at some of these questions that we've got. Okay, so we've got a question from Ilse Lur. Besides contraceptives, has Bayer thought about what it can do for girls and women in the post-COVID era? So perhaps maybe just a little bit more beyond the piece on contraceptives, I think would be interesting.
Yeah, absolutely. So we also invest heavily in partnerships that focus on coaching and capacity building. Since July 2020, we are partnering with the Johns Hopkins University that has brought to life the so-called Challenge Initiative. That's a worldwide program that actually encourages communities and institutions to call for funding of locally well-embedded initiatives. And that's where we really foster education, coaching, capacity building. So that is really an important thing that we have on the radar. The second one that we haven't mentioned today is, I think roughly, if I'm not mistaken, and remember the number correctly, roughly 60% of maternal deaths occur in humanitarian settings. That's another area where we are gradually increasing our commitment in partnership, for example, with the German Red Cross, but also with UNFPA. So what can we do for women in these emergency situations, be it in refugee camps and other settings, where there is a shortage of family planning services and options? So that's, and there we often help, based on our experience around supply chains, with logistic solutions. They are as important as products or services themselves. So that gives you a bit of an idea of what we do above and beyond. So coaching, capacity building, and the humanitarian setting are other areas where we are really investing in and engaging in projects worldwide.
Great, thank you for that. A question for everyone, actually, from Amaya. It's a great question. I'm going to build on it, actually, Amaya. It's asking, you know, if you look at some of the issues that we're facing today, which are very systemic, do we have the right systems in place to deal with these issues? And I think that's another thing, isn't it, that the pandemic has really highlighted, is the systemic nature of these issues. But do you think we have the right infrastructure in place, the right systems in place? A number of you refer to partnerships, but how do we move from, if you like, transactional partnerships? I mean, you talked about being a product partner to being a sort of a broader partner. Do we have the transformational partnerships in place that we really need? Who'd like to jump in on that question? Perhaps I'll ask Maria Rosa to kick us off on that.
Well, that's actually a great question, and there are a few answers that I'd like to give, but the first one maybe goes back to one of my main interests and passions, which is talking about inclusive multilateralism. So, of course, the UN celebrated its 75th anniversary. We're talking about inclusive multilateralism. What is it that we're talking about? I think that's the type of clarity we need to look for, because we are working now with ecosystems, with different actors. Sometimes these types of relationships are, I wouldn't say informal, but we are not equipped to leverage on their full potential. So being able to leverage on that full potential is vital now, because as we were mentioning before, we're talking about ecosystems, again, and this is kind of a mantra that I have. For me, it's important to have these ecosystems, but with clarity of roles. Not everyone doing everything, not everyone doing the same thing. That's the beauty of the ecosystem. So I think we are working to be equipped, and we're working to become somehow fit for purpose, to make sure that we embrace that inclusive multilateralism.
There's actually another question that's coming, which is linked to that point around roles and responsibilities, and that is around accountability. So Mara Ferrari has said, I think PPPs are great solutions, so public-private partnerships are great solutions to the future ahead, but a bit concerned about accountability. Who will be accountable? How do we ensure we have the right governance in place? So anyone like to jump on that aspect of the question?
I think you have to start with clarity of roles, right? So what is it that you can add to the partnership? And the second one, governance, is important, right? Especially when you work with public institutions, for sure there needs to be also a clear and solid governance in place, also in the interest of private sector partners. So I think it really is learning to work on projects together and being clear on the roles, because what is linked to the roles are expectations.
Thank you so much. It's great to see, actually, we've had 5,000 views now and over 400 comments, so thank you so much for your engagement today. We are nearing the end of our hour, but I would like to perhaps end on a slightly more positive note, if we can, which is to ask each of you to maybe say something that you're currently working on or planning to work on that might have a positive impact on the sorts of issues we've been talking about. So perhaps you could share maybe some forward-looking ideas or plans that you have. Perhaps can I start with you, Samira?
Sure. The World Bank works with what we call IDA cycles, so the International Development Assistance Institution. So we decided to shorten the IDA 19 by a year in the wake of the pandemic, and we were hard at work in the past few months writing the papers on IDA 20. So I was the author of the Human Capital special theme, and I'm very excited to report that gender equality is all over the place, because we do actually talk about having essential health services contain reproductive health, including family planning, because we think that this is the only way that they actually remain relevant and in focus when other systems fail. We also talk a lot about the gender dividend, like, you know, really bringing women back to the paid care, to the paid work and paid care and all of these things. So I am very excited in actually having that review by the IDA deputies and taking the whole thing forward, because it will make a difference in our lives and our clients' lives. Thank you.
Thank you so much. Maria Rosa.
Yes, I think we are very much committed in keeping the attention high, and particularly in keeping the attention high on the importance of granting access to family planning, and doing that concretely through partnerships. I think the partnership we're having, and we're just announced also with Bayer, is really an important milestone. It's an example, it's a best practice, and it gives really a concrete content and a follow-up to commitments. Again, I just want to go back quickly to the Nairobi summit of 2019. Public and private partners came with commitments, $8 billion commitments from the private sector. We're very much engaged on our day-to-day work and with our vision in making sure that those commitments become a reality. And I think that the meeting of today is also part of building the awareness on that. Thank you.
Thank you. Klaus.
Yeah, first of all, I would really like to share the optimism that we have to really achieving the 100 million goal that we've set ourselves for 2030. So and where does that optimism come from? So first of all, we've been able to hold up the supply in a situation where the world has been and continues to be in parts of the world, in large parts of the world, under stress. So we have made the investments that are necessary to provide sufficient amount of product. We have announced the investment in Finland. There is more to come later this year. So that is one big commitment that we do as a company. And just to put it into figures, I mean, there's just a little more than 100 months left, yeah, to achieve it. And we have to add roughly, I would say, 500,000 users month by month. And I feel we're on track. And the certainty that we have also is that also within the company, our leaders' remuneration, the board members' remuneration, is linked to achieving this goal. So there is a clear commitment and support of the goals that we've seen here. And we've just recently also expanded the product portfolio that we add to the supranational institutions, including UNFPA and USAID, with an intrauterine device that for the first time becomes available. And last but not least, later this year, we want to extend also our commitment to the challenge initiatives for another couple of years, and we want to expand our engagement in humanitarian settings. So all hands on deck. I'm pretty optimistic that we can make it together. Great. With all our partners.
Thank you so much, and thank you to all of you who's joined us for this hour. It's been a fascinating conversation. For me, a big sort of standout one is, I think there's Samira, your point around this has equity written all over it, but also the comments just there at the end around how together through partnership, by understanding what we will bring to this, actually there was a pathway through. So thank you so much for joining us, and we look forward to staying in touch. Thank you so much.
Thank you.
Thank you.